name is Megan, and I'm doing my informational speech on gestational diabetes. Gestational diabetes happens during pregnancy when your body is not producing enough insulin. It's important for everyone to learn about this because even if you are not planning on having children or you're male, there are probably going to be people in your life, your wife, your family members, sisters, friends, that will be pregnant, and it would be helpful for you to have this information to pass on to them. All women are tested for gestational diabetes between the 24th and 28th week, but it can start showing up as early as 20 weeks. There are women that are at higher risk for developing it, and there are symptoms that you can watch out for. The causes are really unknown for gestational diabetes. The thought is that during pregnancy, the child is growing and creating more hormones in your system, and this causes an interruption in the insulin production. This can lead to higher blood sugar and the gestational diabetes, which is not good for you or your child. Some risk factors are as if you have a family history, such as your mother or your sisters having gestational diabetes, if you are overweight at the time of your pregnancy, if you're over the age of 25 at the time of the pregnancy, or if you're a part of a non-white race. The symptoms might not occur with everyone. They actually usually mimic those of pregnancy, such as unusual thirst, frequent urination, nausea, blurred vision, fatigue, and frequent infections. If you have any of these symptoms and you're concerned about it, it's always good to contact your doctor to make sure that they are also aware of these problems that you think you're having so that you can have your blood sugar tested. Once the child has been born and you've been diagnosed with gestational diabetes, then your doctor will check your blood sugar right away, and then again in 6 to 12 weeks. This is to make sure that your blood sugar is going back to normal. But you will have a higher risk for the type 2 diabetes after having gestational diabetes. So it's good to monitor yourself if you've been diagnosed with it, even after your pregnancy. Some treatments are going to be, of course, your diet, making sure you eat fruits and vegetables and foods that are nutrition and high in fiber. Without the fat and calories that usual sugary foods will give you. Exercise is also very important. How much you exercise before your pregnancy will determine how much you should be exercising during your pregnancy. The doctor can also help you out with if you have been overweight, they can help you with a weight goal. It's never good to lose weight during pregnancy, but the doctor can help you figure out where you need to be and what's best for you and the baby at the time of the pregnancy. Sometimes medication is required to help your blood sugar. The doctor will determine what kind you should use and how often and all that, but it's important to make sure that you and your doctor are on the same wavelength with all of your treatments and understanding everything that's happening with you. It's at all times, it's important for you to monitor yourself, and so that you can help the doctor help you and the baby. While not all women get gestational diabetes and not all women are at risk, all women are tested, again, between the 24 and 28 weeks. This is to ensure that all women are safe and healthy, and so are the children. It's just a drink that you have to take. You wait an hour, and then they test your blood sugar. It's really not that difficult, and it can save a lot of trouble down the road. This type usually only lasts during pregnancy. Again, that's why they check you right after you've had your child, and again to 6 to 8 weeks. And it doesn't always produce those symptoms that I mentioned, but if you're noticing that you have the unusual thirst, frequent urination, nausea, fatigue, blurred vision, or frequent infections, you should contact your doctor just to make sure that they're aware of the situation and can make sure that you are taking care of yourself and the baby. I found a lot of my information from the American Pregnancy Association, Gestational Diabetes and Testing and Treatment, and also the Mayo Clinic staff Gestational Diabetes. Both of these can be found online, just looking up the mayoclinic.org and americanpregnancy.org. Thank you very much, and I hope you've learned more so that you can pass it on to your family members, or you can use it if you yourself are going to be pregnant or are pregnant right now. Thank you.